my name is Katelyn Bruno. I'm a senior research fellow at Mayo Clinic in Jacksonville, Florida, and I just finished presenting at the International Academy of Cardiology Annual Scientific Sessions 2018 in Boston. I gave my talk on the prognostic value of soluble ST2 in clinically and biopsy-proven myocarditis by age and sex. Our work in our laboratory consists of both basic science and clinically translated research on acute myocarditis and dilated cardiomyopathy. Myocarditis is often caused by a viral infection. In the United States, that's most often Coxsackie virus B3 or hand, foot, and mouth disease. And this disease is hard to diagnose. It's often misdiagnosed or underdiagnosed. So discovering new therapeutics and diagnostics or imaging techniques is incredibly beneficial to this patient population. So the talk that I gave today was about one of our new biomarkers that we discovered in myocarditis called soluble ST2. This has been used in other forms of heart failure and has shown to be prognostic in that the level is higher in patients with more severe heart failure or correlated to death versus survival. So in this population, we then looked at soluble ST2 in the sera of myocarditis patients of all ages and sexes, so both males and females. But the way we analyze our data, knowing that sex differences are important in many diseases, is first by sex and then by age, because menopause or andropause can have a significant effect on a disease. And what we found that in patients with acute myocarditis, that soluble ST2 was a good predictor of heart failure in men under the age of 50. So we were able to correlate the ST2 level to New York Heart Association class and then separate and analyze by age and sex rather than controlling for age and sex. And this is a really exciting finding for the field of myocarditis, because there is not good biomarkers, and this biomarker is in the sera, which would be easily be able to be performed at any institution compared to other imaging techniques such as PET or MRI that certain institutions don't have or don't have the ability to read. So new biomarkers are incredibly important. And another exciting thing that I talked about in our talk is that in our animal model, we actually found when you gave soluble ST2 in the form of recombinant ST2 to the mice during myocarditis, we actually found that it was protective and prevented from progression to dilated cardiomyopathy and heart failure. So not only is this suggesting that ST2 is a good diagnostic and could be prognostic, it is also suggesting it could be used as a potential treatment in a patient population that does not have a targeted treatment other than just heart failure medications to keep the patient alive. So this talk was really exciting, and it's about 6 years of our work come together, and we were excited to present it at this meeting, and we're really excited to make a difference for patients with myocarditis and dilated cardiomyopathy.